There are a lot of popular misconceptions about Social Security disability, so I decided to gather the most common ones and make a video about them. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and as usual, everything I say reflects my own opinions based on my own experience and study. The first misconception that I hear a lot is that it's easy to get Social Security disability even if there's nothing wrong with you. Everybody seems to know someone who's on disability who's perfectly fine. Well, my experience has been the exact opposite. I've never had any patient tell me that the disability application process was easy. They all say it's long and difficult. Also, frequently I get patients for re-evaluation. I've seen them once, sent in my report, and their disability claim was denied. And they appeal or apply a second time, and Social Security sends them back to me to examine. And often I'm quite surprised that people weren't approved because I really thought they were disabled. For example, 2 weeks ago, I had a patient that I'd seen previously who'd had a very severe illness that almost killed them and was left with some permanent brain damage to the point where they needed to be in a care home, couldn't drive a car, couldn't look after their finances, couldn't go shopping by themselves, and they had been denied. And their family appealed. The patient wasn't able to do the application process by themselves, and Social Security sent them back to me for a reevaluation. So I'm sure somewhere there's some person who managed to fool the system and get disability with nothing wrong with them, but I think it's extremely rare. The next misconception was pointed out by a viewer in my comments who said that Social Security won't approve disability unless there's obviously something people can see that's wrong with you. And again, that's not been my experience. And most commonly, I see this in patients with mental illness. Let me give you 2 examples. A couple of years back, I saw a person with bipolar type 1 illness, commonly called manic depression. They were in their early 40s, and they'd been admitted to the psychiatric hospital more than 20 times. How can anybody hold down a job if every 6 months they're in the psych ward? Another patient I've talked about in previous videos, a person who had paranoid schizophrenia and heard voices of people plotting to kill him, and told me that every time they took a new job, after a few weeks, they became convinced that their co-workers were plotting to kill them, and even thought that I might be trying to kill them during the exam. I examined both of those people from head to toe, and their physical examination was normal. And they didn't look like raving maniacs either. If you'd seen them on the street or even had a brief conversation with them, you would have noticed nothing amiss. Yet both were seriously disabled. And I've seen patients with physical disability as well that's quite disabling who appeared normal at first glance. The next misconception is that you will get disability approved if you look disabled. And generally that's true, but not always. In the 6 years that I've been doing this, I have had 2 people in wheelchairs who were able to stand and walk completely normally. I could see no reason whatsoever for them to be in wheelchairs, and I suspect that it was to gain sympathy. The next misconception, and I see this often, is that if you qualify for one type of disability, you can qualify for Social Security. Most commonly, I see this in veterans who've qualified for Veterans Administration or VA disability, but it can also happen with private disability, such as disability insurance you buy yourself or that is bought as a group policy through your company. All of these systems are very different and have very different methods of qualifying. And what I've found is that it's considerably more difficult to qualify for Social Security disability than for Veterans Administration disability. That doesn't mean it's impossible, but it is more difficult. The next popular misconception is that if your initial application is denied, it's hopeless and you should give up. That's not true either. In fact, if you really believe that you're disabled and your initial application is denied, you should appeal. If your first appeal is denied, you should appeal a second time. In each case, you have 60 days in which to file an appeal. But your first application being denied does not necessarily mean your situation is hopeless. The next popular misconception regards the use of a disability attorney. Some people will say you always need an attorney, and some people will say you never need an attorney. Now, I'm not a lawyer, so don't take legal advice from me, but from what I've seen, it depends. If you do engage a disability attorney, they're almost always paid on a contingency basis, which means you don't personally pay them any money. However, if your application is approved, they get part of your benefits. Now, if you clearly meet a listing and Social Security will obviously approve you, I see no reason to give an attorney part of your benefits. Here's an example. I saw a patient a few years ago who'd been shot in the mid-back. The bullet had gone through their spinal cord, and their legs had absolutely no feeling and absolutely no movement, not even a twitch with either leg, and they were in a wheelchair. Social Security's listing of impairments says that if you have severe loss of use of both legs, you qualify, period. So this patient was a slam dunk. When would I get an attorney? If my case was complicated, and especially if I was filing an appeal, I would strongly consider getting an attorney. The next popular misconception is that you can't work while receiving disability benefits. The fact is, Social Security wants you to return to work if possible, and they do allow you to continue receiving benefits while working part-time. In 2023, you can earn up to $1,470 a month, which equals $17,640 a year while receiving disability benefits. If you earn more, your benefits are likely to be cut off. The next popular misconception I find a bit frustrating, and that's that doctors like me who do Social Security consultative examinations are paid to say that there's nothing wrong with the people we examine. Again, I've been doing these exams for 6 years now, and no one has ever pressured me to change my opinion of what's wrong with a person, either saying that they're better off than I thought or worse off than I thought. I simply talk to the patient, do my exam, and then put down my opinion, and no one interferes with my opinion. The next popular misconception I've talked about in several videos is that people can tell if you're disabled based on your medical diagnosis, your imaging studies such as MRIs or X-rays, or other tests such as blood tests, cardiograms, etc. The fact is that's impossible. Tests are supporting evidence, but they're not the primary evidence whether or not a person is disabled. Primary evidence comes from the person's recounting of their problems and the doctor's examinations. The next misconception I see is sometimes sad, and that is if you're ill due to the effects of alcoholism or drug addiction, you can get disability benefits while continuing to drink or use. And Social Security is very clear about this. If you've suffered severe health consequences as a result of drinking and or drugging, and you continue to drink or use, Social Security will not approve disability benefits no matter how sick or disabled you are. And from time to time, I see people who are really in a bad state from alcoholism or drug abuse, but are continuing to drink or use. However, if you're in a bad state from drinking or drugging, and you've stopped and you're still disabled, Social Security will approve disability benefits. And the final misconception is fairly minor, but it does impact me, so I'll mention it. Social Security does from time to time order X-rays and some other tests, such as stress tests or pulmonary function tests on patients. It's important to know that this is done through the Central Social Security Administration, not through the doctors who do consultative examinations, although the X-rays are often done in the office where the doctor doing the consultative examination is working. I had one patient who Social Security had ordered X-rays, and the patient thought that the X-rays ordered were of the wrong part of their body and tried to get me to change the X-ray orders. And I had to explain that I didn't order the X-rays and I couldn't change the order. I did, in my report, describe his problems to Social Security, but I did not order the X-rays and couldn't change the order. That has to be done through the Central Social Security office. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.